Hi, I'm Christina. I'm the Superintendent Pharmacist at the Belgravia Centre, and I'm going to talk to you about hair loss. I'm going to talk about how to treat hair loss in pregnancy. It's relatively uncommon to experience hair loss in pregnancy because during pregnancy, hair tends to flourish. Usually it's a time when hair is most nourished, estrogen levels increase in the body, and the anagen, which is a growing phase of hair, tends to increase. If you're noticing excessive hair loss during pregnancy, that is to say more than 50 or 100 hairs shedding per day, then it's usually an underlying cause which might be quite serious that's causing it. It's usually a hormone imbalance or possibly a mineral deficiency that causes thyroid hormone, or perhaps iron deficiency. In any of these cases, it's something that could be quite serious, and we would recommend that you address this to your doctor and have it treated. Most women find that after birth they will have experienced hair loss, and the reason for this is that after birth estrogen levels fall and several more hairs will enter the resting phase and therefore will be shedded. This usually occurs between 3 to 6 months after giving birth. Although most women will find that their hair might grow back on its own, Minoxidil is a treatment that's proven to help restore hair loss. Minoxidil is one of the only 2 proven treatments for hair loss. We have found that it's very effective in a 4%, 5% or 12% treatment doses. If you can get Minoxidil with an added DHT blocker such as medroxyprogesterone or azelaic acid, it'll prove to be much more effective. Minoxidil is dose dependent, so the higher the dose, the more effective the treatment in most situations. But for a proper diagnosis, it's best to come down to a hair loss clinic such as the Belgravia Centre to assess your particular situation and get the best dose of Minoxidil that's suitable for you. Minoxidil 12.5% plus azelaic acid cream has been formulated to treat especially stubborn areas of hair loss on the scalp, such as receding hairline. We have found that it is an extremely effective way of treating this. As Minoxidil is dose dependent, the higher strength of 12.5% is much more effective than the 4 or 5%, and as it's in a cream formulation, it's much easier to apply and much more concentrated in its application. And that really is how to deal with hair loss during pregnancy.